Okay, hi everyone. We're back. A little bit of technical difficulties, but welcome to McDougall's Medicine with Dr. John and Mary McDougall. I'm their daughter and your host, Heather McDougall. And tonight we're going to get to general questions, but first, Dr. McDougall wants to talk about the latest news. Hi, Mom and
I'm
Dad,
not
Dr.
sure.
McDougall and Mary.
I'm not sure I want to talk about it, Heather, because
Third time's the charm.
I put together a nice slide presentation to share with you, and somehow every time we try and get it to go, it doesn't run. We'll work on it this week and hopefully make it better next week. But there were two areas I wanted to discuss with you. One has to do with early detection and screening. I know most of you believe in early detection, mammograms, colonoscopies, PSA testing. The idea there is that we're going to find disease early enough to make a difference. The problem is, if you know the natural history of cancer, and do you have the chat up? Yes, yeah, Heather, with the references. All right. What I've done is I've tried to bring my discussion up to date with the current scientific literature. And so what happens with the growth of cancer is it starts with a single cell, say in the breast or the prostate, and it doubles every 100 days. So in 3.5 months, you've got 2 cancer cells. By the end of a year, you've got 12 cancer cells. By the end of 2 years, you've got, maybe 100 cancer cells. But it takes 6 years of growth before you get to a tumor size that is the very smallest you'd even think about detecting. 6 years it's been growing. And then it contains 1 million cells. It is a millimeter in size. The doublings continue, and eventually you get to a tumor size that's 1 centimeter. Okay, it's the size of an eraser of a pencil. At that size, you can finally detect it. At that size, the PSA level goes up, the mammograms can find it, the breast self-examination can find it, and so on. But this is 10 years old. It's late detection. Now, I've talked to you about this, about the natural history, which was really described in the early 1990s. This kind of natural history discussion appeared in the scientific literature. Well, what you see as your first reference is a discussion of the natural history of cancer, which is a current publication. It's from the National Institutes of Health. Anyway, understanding this, that it's 10 years old before you can find it, what you need to realize is that if a tumor is really a cancer, within those 10 years, it's already spread to other parts of the body. Fortunately, a lot of these tumors aren't cancers and they don't spread to the rest of the body. So we're kind of put behind a difficult situation and trying to find a window of opportunity where the tumor is large enough to find it, but it hasn't spread yet. And that's not the reality in the case of the situation. What I provided for you as the second reference is, it's titled Estimated Lifetime Gain with Cancer Screening. And in this research paper, which you're going to read, because I know your students of this whole discussion, what you find is that in this review, which was published in 2023, it was pretty current, 2023, what they show is there's no overall survival benefit from any cancer screening method except sigmoidoscopy. And that's what I've been trying to tell you over the last, 40 years, but certainly in the time we spent together here. This is a thorough review. This is out of Journal of the American Medical Association of Internal Medicine, one of the most respected journals in the world. And in there, they clearly say mammograms don't save lives. Colonoscopy doesn't save lives. PSAs and rectal exam, they don't save lives because it's a 10-year-old disease by the time you find it. There may be some tumors that are found during this window of opportunity, and you may have a few people. They estimate with breast cancer, if you do 10 years of screening on 2,000 women, you'll save 1 life. But the problem is these screening procedures are associated with health hazards and death. For example, If you have a colonoscopy done, you have a risk of having colon perforation and bleeding that matches any survival benefit that you see through early detection. In other words, you kill as many people as you save. When it comes to PSAs, you do a prostatectomy, you may end up having a person have a heart attack on the operating room table. So you killed that person. You may have saved that person from prostate cancer, but you killed them on the operating table. There's anesthesia deaths, there's surgical complications, and also the fact that all these tumors, I told you they double on average every 100 days, but some double quickly, say every 25 days, and some double slowly, say every 800 days. The truth of the matter is that people will die of competing causes, old age, before the tumor ever had any chance to manifest itself. So when you read this paper, you'll understand what Dr. McDougall's been trying to tell you, is that you're not doing something that will help you in terms of your personal health by getting involved in these screening programs. These are what I term disease mongering. This is where you take people and you turn them into patients by casting a large net over them. In this case, it would be mammograms, or telling you to get breast self-examination, or PSA tests, or CAT scans for lung cancer. They turn people into patients. It's disease mongering. And yet, when you read this paper, you'll see there's no advantage. Now, the last paper that I put up for you has to do with overdiagnosis, which is the real price that you pay when you get involved in these screening programs. And that is that these screening programs, they'll detect cancers, but most of the cancers detected will never manifest themselves. So you've been overdiagnosed. So say, and this is what the Cochrane data says. Say you screen 2,000 women for 10 years. You save one life. In the process, somewhere between 10 and 50 women are diagnosed with breast cancer who would have never developed in her lifetime. And in addition to these women, the 49 women who would have never seen cancer, their life has permanently changed. They can't get health insurance. They can't get life insurance. They may not be able to get a job.
And they're worried all the time.
Yeah. And you meet your friends and relatives. They don't say, "Hi, Marge." They go, "Breast cancer?" They don't say, "Hi, George." They go, "Oh, George got prostate cancer." "Oh, George, this changed your whole life. Don't you think this is important?" Well, I've provided the research for you on all three of these topics. 3 papers here, current within the last year. See, this one was published in the last 2 years. They were published in the last 2 years. And this is the majority opinion. There are people out there with lots of biases and self-interest, conflicts of interest, who will tell you differently. But this is the science. So any of you who are really interested in the natural history of cancer, with implications involving treatment as well as early detection, these 3 papers will lay it all out for you. And they're written in simple enough terms that the average layperson should understand them. Well, that's what I was going to talk about tonight, if I could have shown you the slides. The other thing I was going to talk to you about, which is listed on your sheet, and then we'll get to questions, is I've been telling you that 80% of people in the United States are sick. I was wrong. That was based on being overweight, overfat, obese, and overweight. About 40% of people are obese, and I was putting another 40% into the overweight category. And that's what I've been telling you. That's wrong. That's wrong. I just discovered this in a paper that I just found. It was published in 2017. I should have known better. This paper says that 91% of people in this country are overfat for their health. 91%. Look around you. And that like 69% of kids are too overfat for their health. Everybody is sick. Now, when everybody's sick, there's got to be something major wrong. Either the Homo sapien design, that's human beings, the Homo sapien design is severely flawed, or we're doing something really wrong. And what we're doing really wrong is we're eating the wrong kind of food, as you well know. Because we eat the wrong kind of food, animal foods, refined foods, but primarily animal foods and oils, we end up being obese and still hungry because these foods do not satisfy your hunger drive. You just eat more and more and more, and you end up becoming obese. That's happening to 91% of the people. People try to deal with this hunger drive, which is very powerful. Any of you have any doubt about the power of your hunger drive? Go for the next 3 days without any food and see how you feel. Pain, suffering, you can't do it. Dieters fail as a result. So what dieters try and do is they try and deal with this powerful hunger drive, which is designed to keep you alive. And the attempts go to low-carb diets, which cause you to go into ketosis, which is a state of sickness. Or the more modern attempt is to take something I term reptile poisons, the Gila monster poison. These are the drugs like Wegovy and Ozempic and let's see, what's another one? Manjaro, and there's something Zezpound. Zezbound.
Zezbound. That's the new one. Yeah.
GLP-1 agonists, they're called. And people are so desperate, they'll spend $14,000 or $17,000 to lose on average 37 pounds. It takes them a little over a year, about a year and 3 months to lose that weight. And then they hit a plateau. That's how
if
desperate.
they were really fat, they'd lose more than 37 pounds.
Yeah,
because you lose a certain amount of your body, a certain percentage of your body weight, right?
Yeah, but in the studies done, the reason I came up with that figure, the studies done, the average weight on these overweight people put on the GLP-1 agonists, like Ozempic, et cetera. The average weight was like 230 pounds.
Oh, okay.
And then they offered the weight loss in terms of percentages. They say, well, okay, you take Ozempic, you lose 10% of your weight. You take some of the more powerful ones, you lose up to 20% of your weight. So that's where I came up with the figure of 37 pounds. It's starting with an average baseline of overweight people at 230 pounds. And anyway, there's something really wrong. And what's wrong is that we're eating the wrong kind of food. And the right kind of food is starch-based, starches, rice, corn, potatoes, beans, peas, and lentils, with fruits and vegetables. And that happens to be, as you've heard me say over and over again, the diet of people, the diet of Homo sapiens, human beings. It's a diet that 99.99% of people ever walk this earth is consumed. The bulk of their calories just come from starch. Anyway, I put that paper there for you about the fact that I was wrong. It's really 91% of people are overweight in the United States. And then I followed up with another article that caught my interest. And that had to do with the fact it was a Wall Street Journal article. It was December 15th, 2023. You have the reference there. You can look it up. You can read it. And it's, why are Americans getting shorter? Yeah. Obesity, aging, and more. It's an, well, I told you about this. I told you why you don't have to worry about your children growing to adequate height on this kind of diet. They think, vegetarians, vegans are small and trim. And
because they're not getting enough nutrients.
Not enough nutrients, right. I mean, people have that image. And of course, in parts of the world where they eat a starch-based diet, some of these populations didn't have enough food during adolescence, like the Japanese. But the Chinese did, because they're big and tall. Rural Africans, again, big and tall. They had enough food. But when you don't have enough food during your adolescence, then you end up smaller. All right. So you're worried about your kids growing to adequate size on a healthy diet. What they say here is children on the American diet end up as shorter adults. Why is that? Well, the reason is because when you eat the high-fat Western diet, you increase your estrogen levels in your body. There's a whole discussion on it in the women's book that I wrote. Are you still giving that book away free, Heather? Stop doing it. Okay. It's
That was Christmas.
That was your Christmas gift. It's only $10. It's the women's book, and it was published, many years ago, probably in, I don't know, 1990.
But all the information is still current. We
It's
know
all
that.
current, yeah. What happens is this: high estrogen levels, which are caused by eating the Western diet. Well, first of all, let me tell you what else they cause. High estrogen levels from the food cause precocious puberty. So children as young as 3 years of age are developing breast buds and pubic hair. And at about 10 or 11 years of age, they actually have menstrual periods, sometimes 9. You're supposed to mature at around age 16 or 17 when it's time to have babies. But you're forcing precocious puberty in your children. You also delay menopause by having these high estrogen levels. You stimulate your organs throughout life with high estrogen levels. Overstimulation of the breasts. You get fibrocystic breast disease and breast cancer. Overstimulation of the uterus. You get uterine cancer and endometrial hyperplasia. All kinds of problems from excess estrogen. But one of the things that occurs is the growth plates. Okay, at the end of the bones are growth plates. Each and every bone. These growth plates, called epiphyseal plates, close as a consequence of estrogen. So your children on the Western diet end up shorter because they have high levels of estrogen in their body, which closes their growth plates. And you wondered if I provided the science for you on that. I guess I did. Oh, yes, I did. No, I didn't. Anyway, I meant to. What you all try and provide for you next time is the fact that estrogens do. They close down the epiphyseal joint plates. So anyway, Heather, that's my start for today.
Okay, well, lots of questions coming in the chat. So first question, is there any instance where you would recommend having a mammogram or a colonoscopy?
Yes. You need to think about is doing these procedures for 2 different reasons. One is called screening, which is taking healthy people and looking for disease and turning them into patients. Disease monitoring. That's screening. That's screening mammography, screening colonoscopy, screening PSA tests. The other reason you do these tests is for diagnostic reasons. In other words, you've got a problem. Say you have a lump in your breast and the doctor decides that a mammogram would offer more information on the lump you felt. It really doesn't, but not anything really useful. But just say that the doctor did, then that would be a reason to order the mammogram to further evaluate this lump. It wasn't to find it initially. You got a problem. Now you need to have a diagnostic procedure. Same thing with a colonoscopy. You may end up being screened to find problems like polyps and colon cancers, but you also could start out with bleeding in your stool, blood in your stool. Then if you had the colonoscopy to find out the source of bleed, that would be a diagnostic colonoscopy. I can't see any reason you use a PSA test. That's a prostatic specific antigen as a diagnostic test, but that's a screening test. So yeah, for diagnostic reasons, you should, or you could, or might be to your advantage. I certainly would ask whether or not these technologies would be helpful to you, mammograms, colonoscopies, etc. Now, in our previous discussion, just to go back to that, I hope I mentioned to you the reason that I explained to you that colonoscopies, mammograms, PSA testing, lung screen, etc., didn't save lives. But in this paper you're going to read, it tells you that having a sigmoid exam reduces your risk of dying. Why? A colonoscopy is done with a 6-8 foot tube, which has a high risk of perforation and bleeding, et cetera, killing you. Not a real high rate, but enough so it offsets any advantages. Okay, so
But that's not true with the sigmoid.
no, a
Because it's
sigmoid
a
is a
short-
2 foot tube.
Yeah.
You have no anesthesia. It costs $200 as opposed to $3,000. You're wide awake. The chance of a complication of a perforation or bleeding, et cetera, is, very small. Perforation is almost zero.
But
Bleeding,
The problem is you can't get them.
that's a problem. And you know what it has to do with the money? It's
Yeah.
not the research. I mean, when you read this paper I recited to you in the previous discussion about, they say in there, only sigmoidoscopy, the short tube, has been shown to decrease overall risk of dying. I gave you the paper references.
Thank you. Okay, one more question about screenings. What about Pap screenings, Pap smears?
Okay. In this paper, I think they tell you that there's not much help from Pap smears. I've always been an advocate of Pap smears. I think we could catch these precancerous lesions. The reason that sigmoid works is because you're catching polyps and you're removing precancerous lesions without killing people with a colonoscopy. When it comes to checking your cervix, your female cervix, you likewise can find precancerous changes. And if you remove them, either by curettage, cutting them out or cauterizing them, then you stop the progression that eventually leads to cervical cancer in a few women. Not very common, but it does. So there's a certain category of women who have a higher risk of having cervical cancer. And these are the women that are exposed to wart viruses, human papillomavirus, HPV. HPV causes cervical cancer. It also causes cancer of the throat and the mouth, but cervical cancer would be the most obvious one for you to identify with, and that is because this is a virus that's spread by sexual intercourse. Of course, the ones in the throat are too, by sexual relations. So we want to take and apply this test to only women at high risk. And these would be women who are sexually active, women over the age of, say, 21 to 28, because younger women, even if they're sexually active, are very unlikely to have the cancerous changes occur. And as a result, my recommendation has been, as well as every other gynecologic organization that I'm aware of, has been for you to get 2 negative Pap smears after the age of 21 to 28, if you're sexually active, and then to have a regime that follows. Again, this is what the gynecologic organizations worldwide recommend. After the 2 negative smears, you get a follow-up every 3 to 5 years. There are a few organizations that recommend 2 years, but it's generally every 3 to 5 years you get a repeat exam. And then you stop getting Pap smears for 2 reasons. One is if you have your uterus removed. No sense, right? Women who have hysterectomy should not be getting Pap smears. There's nothing to Pap smear. It's gone.
But they do them anyway.
Well, they do. Still get to charge the same amount.
Yeah.
The other reason to stop Pap smears is when you reach an age where you're going to die first. Once the cells start to change in the cervix, it takes 15 years for them to go from precancer cells to cancer. It takes 15 years, and it takes another 15 to kill a woman. That's a 30-year span. So if you stop doing Pap smears at a point where dying of old age is more likely than dying of cervical cancer, you should stop. And that's around age 50. Say the benefits are within 30 years. It takes 15 to turn from precancerous changes to cancer of the cervix. Another 15 to kill you. You're 80 years old by the time you receive the benefits. So yeah, I recommend Pap smears for those reasons. And again, this paper, I don't think is going to support what I just told you. Pap smears are in full enthusiasm, like I told you. I think they're moderate about it. I recommend Pap smears. I also recommend sigmoid exams and stools for blood and maybe a Cologuard, somewhere or another that you find polyps before they become cancers and you don't end up having the instrumentation, the early detection, the colonoscopy ended up causing more problems than benefits. So.
Thank you. Okay, next question. This is from Chaver. They would like to know how to stop Parkinson's from progressing.
Parkinson's due to pesticide poisoning.
So how do you stop it?
Stop eating pesticides.
Oh, okay.
Well, where do you get pesticides from?
Well, I suppose they put them on all the food.
Yeah.
But it would be on everything.
Yeah, they put it on, they actually use them in all kinds of industry, including the animal husbandry industry.
Yeah.
It's used for a sheep dip where they end up killing various vermin on sheep, and they use it in all kinds of farming practices and spraying the crops in the fields. But what happens is because these pesticides, also known as organic phosphates, they are soluble, fat soluble. And so you accumulate them in your body fat. So when you eat a high fat diet with animal foods in it, you end up with high concentrations of organophosphates, pesticides. And, that's what causes Parkinson's disease.
This would be a good reason to switch to organic foods.
Yeah.
Or not.
Well, I think, but if you want to reduce your intake of environmental chemicals, you can make a move that is more important than that. And that's to eat low on the food chain.
Yeah.
That's where people need to, because if the farmers spray or you end up having these pesticides in the waterways, what happens is a fish will eat the pesticides that are on the seaweed or on the algae. And then what happens is the people eat the fish, and then, or maybe a bear eats the fish. I guess people don't eat bears yet.
People don't eat bears, not yet.
And they take the fish meal and they feed it to other fish. So
Yeah.
anyway, as you move up the food chain, you increase your concentrations of these organophosphates. The reason I mention sheep herders is that's a group of people that's been studied who has neurologic damage consistent with Parkinson's, or sheep farmers who are involved with dipping sheep in these
Because
chemicals.
They put their hands in, or they lift the sheet up.
The environment, it's all these chemicals are every place. Anyway.
Well, I know if I had Parkinson's, I would eat only organic food.
Okay, well, the problem is, Mary, is that what these organophosphates do is they cause a characteristic lesion in the brain. It's an area of the brain called the substantia nigra. It's kind of right back here. We recently call it the substantia nigra, nigra meaning dark or black, is that if you cut a section of the brain, what you'll find is right back here, it's dark. It's pigmented. And that area of the brain gets damaged in particular by these organophosphates. So what do you do about it? Well, there are certain medications that are of help.
Oh yeah, I've heard you mention
Levodopa, Cinnamid, to help control the symptoms. But I don't know of any way to really stop it. But as you would, makes sense to start eating as clean a food as possible, which is beginning would be to eat low on the food chain. And then you start buying organic food from the grocery store, which is what Mary does. We don't promote organic food from the grocery store. We don't want you to fight over whether you're going to get organic brown rice or non-organic brown rice. It's not worth arguing about. The important thing is that you eat the rice. So anyway, it's a tough disease. It's not reversible. There's some symptomatic treatment associated with it, like levodopa or Cinnamid, and not many other drugs are of much value. You don't want to get it. You want to start out early in life eating a healthy diet.
Thank you. Next question. This is from Christina. She's been having some pain and discomfort due to dental work, getting ready for braces, and is wondering if taking 200 milligrams of ibuprofen every 12 hours for about a month would be okay.
Probably. Non-steroidal anti-inflammatory drugs, which ibuprofen is, so is aspirin. Aspirin is a non-steroidal anti-inflammatory drug. It's a little different than, say, naproxen or Motrin. These non-steroidal anti-inflammatory drugs, they increase your risk of dying of heart disease, having heart attacks. The aspirin type of non-steroidal anti-inflammatory drugs actually cause you to reduce your risk of heart attacks because they thin the blood. So you have an increased risk of suffering a heart attack when you take these drugs. A month, I don't know whether a month is enough. Probably not. I mean, so many people take these drugs as a much longer interval and even a higher frequency, and they seem to do okay. When you compare taking non-steroidal anti-inflammatory drugs to, say, aspirin, most of you are aware that aspirin causes burning of your stomach, causes lesions that bleed when you take aspirin. Well, non-steroidal anti-inflammatory drugs like naproxen or Motrin, they causes more serious bleeding, indigestion, other problems than does aspirin. Non-steroidal anti-inflammatory drugs, they inhibit something called prostaglandins, which are little tiny hormones in the body, which are responsible for growth, all kinds of things. Prostaglandins are. Well, these are prostaglandin inhibitors. They inhibit these small chemicals. That's how they work with inflammation. Well, prostaglandins are involved with the growth of cartilage. And so when people with arthritis, and that's the reason they take it, is because of the pain of arthritis, when they take these non-steroidal anti-inflammatory drugs, they have more rapid deterioration than somebody who doesn't, because you interfere with the prostaglandins. So your joints don't repair themselves well, and they deteriorate. There are some exceptions. Feldine is an exception, aspirin is an exception. That doesn't seem to cause this change in prostaglandins that are detrimental to the joints. So, probably a month is not going to make any drastic difference in your life, but you are probably going to feel the indigestion part, but you won't notice the deterioration in your joints. But you'll notice the stomach discomfort.
Thank you. David's writing in. He's been vegan for many years, but just had a bad bout of kidney stones. So he's wondering the best way to avoid those in the future.
Well, kidney stones, most kidney stones are made of calcium oxalate, over 95%. There are a few kidney stones that are made of other ingredients like uric acid, bilirubin, et cetera. But most of your kidney stones are made of calcium oxalate. And the way you avoid them is not by avoiding high oxalate foods, which are plant foods, particularly green and yellow vegetables. They're loaded with oxalates. The way you avoid the kidney stones is you cut down on the fat in your diet, because the oxalates in plant foods are in complexes. They're formed in insoluble complexes in the plant parts. When you eat them, they stay complexed and they're not able to be absorbed. But if you eat fat, vegetable fat or animal fat, a process called saponification occurs. Kind of sounds like soap, but it's spelled different. It's S-O-P, saponification. The A's left out. You can look it up. Saponification occurs, which frees up the oxalate, and now the oxalate gets into the kidney system and it combines with calcium, which is there in large amounts because of all the animal protein you ate, which causes the bones, because of the acidic condition you created, causes the bones to dissolve and excrete calcium. So now you got calcium oxalate in your kidney fluids, your urine, your pre-urine fluids, and they solidify into crystals called calcium oxalate kidney stones.
So if he was a vegan, you would assume that he's a vegan that eats
Low fat, I would hope.
Well, if he had kidney stones, wouldn't he eat
Oh,
a higher fat,
his old days, he ate that way. He
Oh,
formed
okay.
the stones years before
Oh,
he became a vegan.
all right.
In populations of people who eat a starch-based diet, kidney stones are extremely rare. During World War II in Western Europe, kidney stones became very rare. And one of the papers that was written about the formation of kidney stones was a paper written about, several papers, written about the stone epidemic that occurred after the wars in Europe. When the good food returned, they had an epidemic of kidney stones. So, it's pretty clear that that's the situation. If you want to avoid kidney stones, you need to eat a low-fat diet. You don't avoid oxalates that are in plant foods, but people get fooled. Even kidney specialists I run into get fooled. They don't understand this. I had a discussion with one of the kidney specialists you may be familiar with. I'm not going to mention his name, but he's on a lot of the vegan shows. And he was telling people to eat a diet low in oxalates, in other words, low in plant foods, to avoid kidney stones. But in the next sentence, he said, in populations where they eat a low-fat diet with lots of vegetables, they have almost no kidney stones. And he couldn't explain the contradiction here. But then I explained to him, look, the calcium oxalate's bound in the plants, it's not absorbed. You've got to eat the fat to free up the oxalate. And that's why you see high rates of calcium oxalate kidney stones in populations that eat a high-fat, animal-laden diet. Anyway, I don't know whether he learned from the literature I sent him or not, but hopefully he did, and then he wouldn't be confused.
Thank you. Next question. Penny's writing in and wondering if there's a cure for Lou Gehrig's disease or ALS.
No, I don't think so. I don't think so. If I had to guess what ALS is caused by, it would be an environmental heavy metal poisoning. That would be my best guess. There's not a lot been written on it, but I think it's probably from an environmental, maybe a heavy metal contaminant, and it's not curable. It's not reversible.
Some people seem to live longer than others.
Yeah, they do. And would I recommend a starch-based healthy diet to somebody with ALS? Yeah. I mean, why would you want to die constipated? I mean, here you're fighting a very serious problem. Why would you want to have other problems in your health? Why would you want to have a weight problem where you couldn't get out of your wheelchair because you were too big and too cumbersome? Yeah, I would recommend you eat a healthy diet if you have ALS. Even if you cut one of your arms off, I'd recommend a healthy diet. Doesn't matter. I know things happen to you, and not all of them are dietarily caused, but there's no reason for you to not eat a healthy diet. If you happen to own race horses, horses, okay, those are four-legged animals run down the track, and your horse breaks its leg, do you put him on meat? Of course not. There's a diet best for horses. You don't change, same thing with you. No matter what's wrong with you, you need to eat the diet for human beings, which is a diet of starch with the addition of fruits and vegetables. No animal foods required. In fact, as I'm trying to tell you, you want to avoid them. And also you want to avoid free oils. Heather, I only because I watched it yesterday and today, and I'm only through the 3 of the 4 seasons of this documentary on Netflix.
Episodes,
yeah. It's a 4-episode part about what you eat, the twin experiment. I want to make some comments. I think you all ought to watch this. I mean, it talks to you about the implications of the environment, the harms of a diet, and so on. But they make us
talks a lot about the environment.
Yeah. And the mistreatment of animals and all kinds of really, really important things. But when they get down to the practical aspects, they fall into the trap of recommending typical whole food, plant-based diets. That is, they emphasize green and yellow vegetables. And they act like that's what you're supposed to be eating most of. Broccoli, cauliflower, kale, asparagus. That's what in fact, they show a plate where they have 1/4 is starch and half of it is green and yellow vegetables.
Yeah, but what about some of the meals that they showed that they ate? They used fake.
Oh yeah,
Fake
then
meats.
they went into that whole thing too. So the practical improvements that could be made in this documentary is they could have taught a starch-based diet. You can't live on a diet of broccoli and cauliflower and kale. You can't eat enough. These are not intended. No population has ever lived on those kinds of diets. If you tried to grow enough food based on these non-starchy green and yellow vegetables, you could never feed the population of the planet. Even 1/10 of the population of the planet. They produce too few calories. They're too expensive to grow. You have to identify the source of calories as starch, which they didn't do. I mean, they're close. It was well worth watching, but understand the mistake. And that is that people, the vegans who they had in the study, had some difficulty eating all these green and yellow vegetables. Understand that no population of people has ever lived on a non-starchy green and yellow vegetable diet. Never happened. And that population lived on a starch-based diet, which they should have been teaching rice, corn, potatoes, sweet potatoes, etc., throughout all of human history. Starch has to be the center. And as Mary mentioned, the other thing they did is they fell into the fake food trap. A big discussion of this in this third episode I just got done watching, is they fall into the same trap that so many people are falling into, is all I got to be is a vegan. So I'll have Boca burgers.
Yeah, fake meat,
fake hot dogs, fake cheeses.
They talk about the environmental benefits, which I think is good.
And good for the animals.
Yeah.
The animals are happy. But as far as your personal health, you're just trading one form of damage to another. You're deciding whether you want to be shot or hung. You could do better. So these fake foods should be out of your diet. Cheeses are 90% fat. You know, we saw this contains a whole. The people in this documentary, by the way, are people we've worked with throughout the last 20, 30 years. We know them really well. We know where they come from. We know what they teach and so on. And they do a wonderful, important job. And I'm so glad that they made this documentary. But, you know, 2 important points when they compare the 4 sets of vegans or twins, they compare 4 sets of twins, is that they didn't do as well as they could or should because they didn't teach a starch-based diet. They didn't like the food as well as they could or should. They didn't get the benefits in terms of health, in terms of physical appearance that they could and should. They didn't get the weight losses that they could and should because they didn't make the meal plan correctly. The human being is a starch eater, a starchivore, a starchitarian. Can you imagine, you know, the Japanese population of people living off seaweed?
No.
Yeah, when you think of Japanese food, you think of seaweed. Maybe that's what they eat. I'd still be vegan. No, you live on rice. 90% of their diet's rice. So, you know, when you watch the documentary, make sure that you understand that they've come a long way.
Well, that's one thing that you'll notice right away when you watch the documentary. Is how much focus there is on the fake foods, which is unfortunate.
Yeah. Well, we know better.
Yeah.
You know, and you know what? You know, like I say, we've been dealing with these people for the last 30 years. A good share of them have been speakers at our advanced study weekends. But we know them. Some of them have been teachers in our program that are in this documentary. So we've had a relationship for a long time with these. They've again made great contributions, but they just don't get the starch part. I don't know.
I'll have to watch it.
Yeah, it's good.
It's well worth your trouble. It's going to take you 4 hours, well worth your time, but make sure that this is not the McDougall program. All right. You're not going to get the benefits and health that we promise you by going to fake meats and making most of your diet non-starchy green and yellow vegetables, broccoli, cauliflower, etc. It ain't going to work. Nobody's ever done it. The planet can't afford it. It's impractical. You'll end up being a frustrated vegan if you try it. It's starch, oatmeal for breakfast, pancakes, waffles, hash brown potatoes for breakfast, not fake eggs. You see them make that egg?
Yes, I did.
They made an egg with a white and a yolk. Fake.
They made the white from silken tofu, and they had a little egg-shaped cup that they put it in, and then they made the yolk with a bunch of
Yellow stuff.
That they added turmeric and things to make it really yellow, and then they scooped out the center and put this yellow thing in it. It looked just like an egg.
Really. Something that comes out of the cloaca of a bird. The cloaca is where the bird passes.
We know.
Do you know that? Do you know that? Do they know what a cloaca is for?
Sure they do.
Eggs come out of cloacas, and so do a couple of other things. Anyway, I think we've hit that a little hard.
I think so.
Watch it. It's good. It'll help you and your
Okay.
friends a lot.
Moving on. All right. Here's a question that we've kind of talked about answering. Have you done any research on the RSV vaccine?
Not yet, Heather. I mean, I have. I've been looking at the studies. I'm still waiting. And remember that I'm waiting for a vaccine. I believe in vaccines. You know, all our family is immunized with vaccines that work. DPT shots, hepatitis shots, polio vaccines. You know, all these work because measles, chickenpox, because the viruses in the community are stable. Same virus appears all the time. And so our body can make antibodies to it, or our body can make antibodies to a similar set of proteins called a vaccine, which attack and kill these bacteria and viruses. The problem with some of the viruses, and I'll name two in particular that I know for sure, the influenza virus and the COVID virus, is the genetic drift is rapid. In other words, they change the genetic makeup of the virus itself. It changes all the time. You see variants coming out every week.
There's a new variant for COVID that just came out.
Right. But yeah, flu and COVID, it's the same thing. They make a vaccine for one of these viruses, flu or COVID, worked just great, be doing fine if that was the variant that was still circulating, but it's not. They made a vaccine against a virus, say, with flu that was running rapid across the globe, say, a year ago or 3 years ago. But that same virus didn't come across the world in this year, and the vaccines are useless. Anyway, the RSV, still, I haven't come to an opinion as to whether or not it causes people to miss less work, more infrequent hospitalizations, you know, real solid clinical criteria. I don't want to hear about an antibody response. I want to hear that these people ended up healthier or sick less long and severe by taking the vaccine. RSV.
Well, at least they haven't started talking about variants.
With RSV?
With RSV.
Not that I've heard of. No.
No.
But it's kind of new, you know.
Yeah.
Recommended for kids and people that are old like us.
True.
Anyway, that's as far as I can say with RSV. But I'm still looking right now. Mary and I don't plan on getting the RSV shot. We're not getting any more COVIDs unless they get it right. I don't think they will. We're not getting any flu shots. I haven't gotten flu shots for over 20 years. Not going to do it. But you know, there are all kinds of vaccines, including HPV, which is related to that cervical cancer we were talking about. There's a vaccine from that I believe is effective, and that young people who are about to become sexually active and spread this virus, they can get a vaccination and protect the boys and their offspring and the female partners from getting cervical cancer. Anyway,
So, but it's for both sexes. You don't, it's not just recommended for,
No, it's because boys give girls viruses and boys catch the virus in their mouth.
yeah, but women, you recommend the vaccine for women also.
Yeah, little girls, young
Yeah,
girls.
yeah.
I think it starts when they are young.
Yeah,
For young girls and for young boys. You say, why boys? Boys don't have a cervical cancer. Well, they pass it on to their girlfriends who do get cervical cancer. And both sexes, if the virus infects the mouth and the throat, you get oral pharyngeal cancer, and that's really deadly. And we've had some movie stars recently that have had this.
yeah. We probably shouldn't mention
Oh,
that name.
but you hear
But
about
most
people have
people-
oral. This is venereal. This is from sexual relations. Anyway, so there's a good vaccine out for that, I think.
Thank you. Okay, next question. This is from Lorna. She's wondering if someone has had triple negative breast cancer, the growth was removed and chemo and radiation was done, how would you monitor? Would you monitor?
No. Once you get treatment, you should not have regular follow-ups. The scientific medical establishment clearly states that follow-up visits are not in your best interest. Say you've had a cancer like breast cancer, or prostate cancer, or colon cancer. Why aren't they in your best interest? Is because if therapies were available that worked, they would have given you these treatments at the time you initially had the problem. Why are they withholding this little bit of remedy from you that they're going to give you later if you appear in their offices and certain things change and then you get the drug that works? No, the follow-up, you end up destroys the 2 weeks before you go to the doctor, and the 2 weeks afterwards, you have tests done. You sure the technician had a grimace on her smile, and she thought something negative when she saw your test, so that ruined a couple of weeks. No, you get on with your life. You've been through the treatments, which I'd be happy to comment on. You realize I only recommend a lumpectomy, no radiation, no routine chemotherapy, and also the possibility of adding anti-estrogen therapy. So take the lump out, clear margins, a little bit of cutting down on estrogen hormones by either having the ovaries removed, taking tamoxifen, or aromatase inhibitors. And of course, the major impact will come from changing your diet. Yeah, that's where the big deal is. And
Because you believe that you can slow the doubling time of cancer growth by eating healthier.
yes, and we have some evidence to that comes from worldwide studies. For example, in Japan, after World War II, breast cancer was, they could count the number of cases on a couple of hands. It was extremely rare. But post-World War II, the Japanese women changed their diet. And so they started developing breast cancer. But when Ernst Winder, who I've talked to you about, he was one of my mentors, when Ernst Winder's group from the American Health Foundation studied the survival of Japanese women with breast cancer compared to American women with breast cancer, the Japanese women lived 2 to 4 times longer because they ate a healthier diet of rice and vegetables. So, we see some practical implications on how even after you get a cancer, that diet has a huge impact. And the information is so great that the American Cancer Society came out February 13th in the year 2015 and told the public and practicing physicians that even after you have cancer, you should eat a diet similar to what Dr. McDougall recommends. They didn't use those words, but the same kind of thing I'm trying to tell you. In their very words, more fruits, more vegetables, more whole grains, less meat, less red meat, less oil. Right there, the American Cancer Society knows, and that's after you get the cancer. So follow up in your kitchen. If something happens that you need to know about, which you may require some symptomatic treatment, say, for example, you get a metastasis to the bone and you get pain, you will know And that's the time to see the doctor. And that's the time where symptomatic treatment, such as radiation to the metastatic area, may be valuable. But we're talking about late treatment of disease. In the time from you've been diagnosed to the time when things become a real problem, you need to enjoy your life. These are years that should be positive, enjoyable, not years spent worrying about when's my next doctor's appointment. I hope they don't find anything this time. Maybe the doctor will give me his special drugs this time if I follow up. Get on with your life. They have nothing to offer you.
Thank you. Okay, next question. This is from Gladys. She's writing in wanting to know if you believe that getting your A1C below 6 to be diabetes free is important, because she's, I think, just trying to manage her numbers and is feeling very frustrated.
All right. Hemoglobin A1C is a measurement of long-term control of your blood sugar. When you check your blood sugar, say in a finger stick in the morning, that's an instantaneous result. That's your blood sugar is at that moment. But over a period of time, what happens is the glucoses in the blood get attached to proteins. And one of the proteins that sugar gets attached to is called hemoglobin. And so you have this hemoglobin molecule, which is part of your red blood cells, which has a whole bunch of sugars attached to it because you had a high blood sugar level for 2 or 3 or 4 months. That's the kind of measurement it is. All right. So doctors use one or the two type of measurements to diagnose and to manage diabetes, either instantaneous blood sugars and or hemoglobin A1C. The idea that making the hemoglobin A1C normal by current therapies is to the benefit of the patient was proven to be harmful beyond a doubt with 6 studies. There are no other studies. There are only 6. There's the veteran study. There's the European study, the TRACE study, the Accord study, the advanced studies, and the second veteran study. The last 3 were published in the New England Journal of Medicine. What they did, these were randomized controlled trials, huge amount of drug money to prove it's good to make your hemoglobin A1C normal, which is 6%. And they compared a group that was aggressively treated, I mean, thousands of people, aggressively treated, maybe 4 shots of insulin a day, maybe tested the blood 4 times a day, maybe taking 2 or 3 or 4 different kinds of pills a day to drive that blood sugar down. In each and every case, what they found was those who had aggressive treatment used in their care, in other words, their hemoglobin A1C went close to normal, 6%, had an increased risk of dying, so much so that the National Heart and Blood Institute stopped the Accord study 17 months early because of the increased risk of death caused by aggressively treating the diabetes. That was the Accord. The Advance showed no benefit for heart disease. The Veterans showed you had triple the risk of sudden death. You had twice the weight gain. No, you don't want to be normal based on drug therapy. You want to be normal based on curing the disease or benefiting the disease. And then it's okay to have a hemoglobin A1C of 6%, but not by drugs. I hope that makes sense.
Thank you. Next question. This is from Struth. What advice would you give to someone with bipolar?
Oh, you're talking about depression and mania.
Yes.
Take lithium. Take lithium. Take lithium.
That's his advice.
That's my advice. So lithium is a highly effective drug when it comes to manic depression, bipolar. The reason it's not popular is because
It's generic.
it doesn't cost anything.
It's cheap.
It's just a salt. But, it's been proven in many, many ways that lithium is a highly effective, relatively non-toxic, extremely inexpensive way to treat manic depression or bipolar. So that's what I'd recommend. The other drugs, which are brand names, hugely profitable to the drug companies, have far more side effects and far fewer benefits than does lithium in treating manic depression. Okay, that's one way I'd approach it. The other is you can control your mood, in other words, your mania and your depressiveness, by things that you do. Things that, let's just talk about relieving depression. Eating a low animal protein diet causes the production of neurotransmitters, serotonin, in the brain and the spinal fluid that actually relieve depression. This was work done by the Wortmans in the 1980s at MIT. So eating a starch-based diet makes it so that your neurochemistry, your spinal fluid, contains the right neurotransmitters to relieve depression. Exercising, you've heard about the runner's high, endorphins. So getting out and exercise, that'll relieve some of the depression. Sunshine, you've probably heard of seasonal affective disorder. You need some sunshine to relieve depression. So you've got food, exercise, sunshine, but the most potent way to relieve depression, in fact, to the point where you can cause mania, is to control your sleep. Sleep is depressogenic. You know this. You know this because you've had experiences like mine. On the weekends when I'd sleep in, say get my usual, instead of my usual 6, 7 hours, I'd get 8 or 9. The weekend was blue. There was a shadow cast over the way I felt. And you also had the experience of creating mania. Like, for example, when you were in college, I remember getting to the end of the semester and having to pull all-nighters. You know, the first couple of days, myself and my roommates didn't have any sleep. We started feeling pretty good. And by the third day, we were manic. We were bouncing off the walls. So you can use these diet and lifestyle maneuvers, no cost, no side effects, no harm done to anybody, in addition to taking lithium. Makes sense. By the way, that's in my March 2004 newsletter. You can read all about that. Not about lithium, but about the things that you can do that are non-toxic diet and lifestyle changes, including sleep.
Okay, that was an hour. Thank you. That went by fast.
Well, Heather, we need to practice our technical problems.
We will before next
Anyway,
Sunday.
thanks for your patience, folks. Before we leave, Heather, I know you have a oversold program this time. How many? We have residents from medical schools in our 12-day program.
Our program's full that we're running right now. And we also have 8 medical residents that are going through the program. So that's really exciting too. Training medical students, the importance of lifestyle medicine. So we're busy with that, but we'll see you all next Sunday at 5 p.m. Pacific.
When is the next program?
March.
All right.
And we're filling up.
That will sell out early too. I think the time has come where people see some value in what we're doing. I certainly hope so. For your sake, not just ours.
Well, we love what we do. All right, that was a great hour. Thank you all for tuning in. We will see you next Sunday at 5 p.m. Pacific. Thanks, Dr. McDougall and Mary. Bye, everyone.